The main difference is in kids. You could have anemia in newborn children because of some congenital problems. In other words, they could have inborn some enzyme deficiencies that can cause anemia. They could have intestinal obstruction. They could have some kids may not be eating a balanced diet, which in turn can cause anemia. So in kids, and then also in India is very common in rural areas. We'll see a lot of hookworm infections, which can cause iron deficiency. So in children, typically newborn, small like babies, infants, and small babies. Typically, they suggest pediatricians would recommend some kind of iron supplements in the diet. But anybody with infections obviously need to be treated. Typically, bleeding is not a big issue in children. It's mostly in adults, men, and older men and women. We're always concerned about internal bleeding. So in kids, I would definitely say the difference is that small children can have genetic predisposition. They could have gene disorders that can cause anemia, or they could have enzyme deficiencies that can cause anemia. Or if the child is not eating properly, not eating vegetables, they're not eating any green leafy vegetables, they're not eating nuts or any balanced diet, they're only sticking to meats. So these are people that can have anemia. I just want you to remember one thing. If you are a man and if you're anemic, you need to be evaluated thoroughly, because you could have an underlying, it could be a simple stomach ulcer or a small precancerous growth either in your stomach or your colon, or it could even be some hidden cancer, or it could be something else, something dangerous that needs to be investigated. The same thing in women. If you are a woman beyond menstrual cycle, if you're above 52, if you've stopped your menstrual cycle and you're still anemic, we need to investigate further. It's very important to try to find the underlying cause. In medicine, our goal is always to find what is the cause and how do we treat it. So please don't ignore if your parents or if your brother or older sister or somebody is anemic, they need to be thoroughly investigated.